Welcome to the Deep Wealth Podcast, where you learn how to extract your business and personal deep wealth. I'm your host, Jeffrey Feldberg. This podcast is brought to you by Deep Wealth and the 90-Day Deep Wealth Experience. When it comes to your business deep wealth, your exit or liquidity event is the most important financial decision of your life. But unfortunately, up to 90% of liquidity events fail. Think about all that time and your hard-earned money wasted. Of the quote-unquote successful liquidity events, most business owners leave 50% to over 100% of the deal value in the buyer's pocket and don't even know it. I should know. I said no to a seven-figure offer and yes to mastering the art and the science of a liquidity event. 2 years later, I said yes to a different buyer with a 9-figure deal. Are you thinking about an exit or liquidity event? Don't become a statistic and make the fatal mistake of believing the skills that built your business are the same ones to sell it. After all, how can you master something you've never done before? Let the 90-Day Deep Wealth Experience and the 9-step roadmap of preparation help you capture the best deal instead of any deal. At the end of this episode, take a moment and hear from business owners like you who went through the Deep Wealth Experience. Dr. Sawiak retired from Biologic Dentistry, where she was the first woman in the world to achieve the Master of the Academy of Dentistry. Seeing a need for people to make more educated choices to protect their health, she pursued her doctor in Integrative Medicine and now practices Integrative Wellness, helping people from all over the world to uncover the causes of their illness, not just masking the symptoms and finding the most effective and safe solutions for them. Dr. Sawiak is an international speaker, having presented at numerous international conferences and summits. Her clients have branded Dr. Sawiak as the Health Detective because of her ability to find the clues underlying their illnesses. Today, Dr. Sawiak is fulfilling her passion of spreading the health message to whoever is ready to own their health instead of allowing Pharma, governments, and other special interest groups to guide them into a lifetime of dependence on drugs, chemo, and surgery. Welcome to the Deep Wealth Podcast, and the doctor is in the house. The doctor is in the house, and you heard it in the official introduction. We have a thought leader, a world-renowned lecturer, someone who is out there making the lives of people better with information you're not going to hear anywhere else. But I'm going to stop it right there. Dr. Sawiak, thank you so much for being with us today on the Deep Wealth Podcast. And I'm curious because there's always a story behind the story. So Dr. Sawiak, what's your story? What got you to where you are today?
Thank you, Jeffrey. I was always interested in health. Apparently, when I was 5 years old, I was fixing dogs' broken leg. So I didn't know what I was doing, but I was fixing it. And so always I had this inclination to try and help people. And I was good in school, so I had a choice of career choices. Mm-hmm. And because medicine scared me, right, I decided to go into dentistry, thinking it was a health profession. Unfortunately, I found out it's not. It's drill, fill, and bill. And that dentistry does not consider teeth to be part of the body, really. You can do anything to a tooth and it doesn't affect them. And then after about 10 years in dentistry, I seemed to be attracting a lot of what I'd say health nuts. And I had just heard a lecture by a crazy guy by the name of Hal Huggins, who said there's mercury in those fillings and you're poisoning your patients. And so that started me on a path of looking at dentistry and its health. And when I graduated, I had done an internship for a year in hospital. And so that was probably the start of my thinking process. But at the time, I didn't recognize it. Anyways, going forward, I joined the International Academy of Oral Medicine and Toxicology, and their motto is, show us the science. And I started seeing science that I was not reading in the dental journals or the medical journals, but this was pure science that was not bought and paid for by any interest group. And lo and behold, I realized that dentistry was a whole body, did affect the whole body. And the more I dove into it, the more disenchanted I got by what we were being taught. And so more and more, I started looking at the health effects of what I was doing and changing my approach to dentistry. So the last 10 years, I would say I was a biological or holistic or integrative dentist rather than what I was taught. And then when I retired, I was still very interested in spreading the message of health to people because, as you said, health is wealth, and people suffer with chronic diseases with diagnoses that are symptom-based and not cause-based. And so for me, it was important for people to learn that they can own their health rather than be victims of it. And so I got my Doctor of Integrative Medicine. And this is what I do now, is find the causes of what many people call mystery syndromes. Because many people come to me and say, I'm on this and this drug because I have this and this problem. The doctor says there's no cure for it, and he doesn't know the cause. And that's the kind of thing that people come to me for.
And so, Dr. Sawiak, for the benefit of our listeners, let's put a pause for just a moment because our community is growing by leaps and bounds, and we're so grateful. And so for our listeners who are saying, Jeffrey, wait a minute, isn't Deep Wealth about building a business, growing it, preparing for a liquidity event? Why do you have a doctor on the podcast? And for our new listeners, Deep Wealth, I'll remind you, we want you to extract, quote unquote, pun intended, your deep wealth, which just isn't business, it's also personal. Because if you're not feeling well, if you're not at the top of your game, it'll reflect in your business. And Dr. Sawiak, as you and I were speaking offline, Benjamin Franklin, great individual, who said, your wealth is your first health. And so for our listeners, this is why we do these podcasts. We'll bring on doctors and scientists, nothing to do with business, but everything to do with your business so that you can be in the business of being a business. And Dr. Sawiak, I want to now connect the dots because I'm sure some listeners are saying, okay, dentists, I understand what a dentist is, not quite sure what integrative medicine is and what that means. And I'll ask you about that in a moment. But I'm going to really pile up on this because, and you can confirm if I'm on base or off base, when it comes to cancer, Alzheimer's, Parkinson's, all these terrible diseases that are out there, science is now showing that it starts in the gut, but before it even gets to the gut, it's really starting in the mouth, which then gets to the gut. And to me, that's the link of you being a dentist, which makes you so unique and now an integrative doctor. So for our listeners out there, what's integrative medicine? What are you doing? What's that all about?
One of the things, for instance, that I learned is that you do not clean a mouth where the gums are bleeding. You first take a microscope, put the plaque under a microscope, and find out what the infection is before you clean and spread the infections throughout the mouth and into the blood. So that was number one. Number two was, of course, the toxicity of materials. And we always think of, these fillings, they're white fillings, they're okay. But many of them have BPA in them. So I was looking at materials that were not toxic, like the old amalgams were. And by the way, amalgams contain mercury. If you take tooth out containing one of these fillings and throw it into a small lake, within 24 hours, there is a fish advisory. You cannot eat the fish from that lake. And so it is still being used in dentistry. Unfortunately, all the military, all the institutions, all the school programs still use the material. And chewing on it releases mercury every time you chew, every time you have something hot or acidic. So that is a factor in Alzheimer's, for instance, or in MS, or ALS, Parkinson's, because mercury is a very severe toxin and it's very difficult to detoxify from. So unless you go in and medically or holistically detoxify from it, you end up with precursors to these scary diseases that we all fear.
And Dr. Sawiak, let me just jump in here for just a moment and we'll get to the integrative medicine, but on the dental side, because we're talking about that, I mean, one, it's shocking that's still being used, but for the benefit of our listeners, I was speaking to a friend the other day and he said, Jeffrey, I need to get a root canal. And I said to my friend, don't do it. Better to have your tooth pulled out than get a root canal because you'll have infections and all kinds of other things that we're now finding out. And he said, oh, no, my dentist said it was fine and it was safe and there's nothing to worry about. And so before we get to the integrative side, while we're still on the dentistry side, there is a method to this madness in this interview, believe it or not. What would you say to people when it comes to their oral health and root canals and what they should know when it comes to oral health?
If you are told that you need a root canal, I encourage you to look up the film called The Root Cause. It explains how a root canal will not only infect you or keep you infected, but also it causes the meridian to be blocked on that side, on that tooth, because each meridian goes through a tooth, a muscle, an organ. And so if it's on the breast meridian, it can cause breast cancer. If it's on the pancreas meridian, it can cause diabetes. It's not the only factor, but no disease is caused by one factor. It's always multifactorial. And so we look at all the factors that could cause the problem. So Alzheimer's is not caused just by age. It is caused by infection and it's caused by toxicity. So dentistry has been a factor in the Alzheimer's development, and Alzheimer's did not exist before dentistry started using amalgams.
And so if I'm hearing you correctly, what you're saying is we can link the rise in Alzheimer's to what dentistry has been doing with the amalgams and the kinds of materials that are being used.
Yeah. Now, the world itself also has become very toxic. So the mercury that is in the atmosphere coming from China is a factor. The mercury in every vaccine is a factor. The fact that they sterilize things like Q-tips with mercury vapor is a factor. So there are many factors, and never is it one factor. But dentistry is a factor in our health, and to be aware of that and own your own health is my passion to teach.
And so now we're going to bring this full circle, and for the benefit of our listeners, with what you're doing on the dentistry side, with your background as being a former dentist, and now on the integrative medicine side. So for someone who's saying, okay, listen, I see my doctor once a year, I have my annual physical, and hopefully it's only once a year, hopefully not more. I'm having my annual physical and everything's great. And yeah, meridians, whatever, I don't see how meridians have anything to do with my health and teeth and everything else. So what's the difference with someone like yourself, who's an integrative medicine doctor, and without any judgment for a regular doctor? What are the differences? Why would I want to consider working with someone like yourself, who's my integrative medicine doctor, over a traditional doctor?
Medicine has veered away from treating the cause to treating symptoms. And this is the influence of the big pharma movement. When I was born, we didn't have penicillin. So at 6 weeks old, I got pneumonia, and my mother was told that I was going to die. Apparently, some neighbor called a country doctor, did cupping on me and saved my life. And this is the kind of thing that we don't have now, because for every symptom, there's a drug, but there is no drug that doesn't have side effects.
Sure.
And all we're treating are symptoms. We're not treating causes. And so medicine has veered off into that abyss, just as dentistry has. And we need to go back to saying, okay, what's causing this problem? And if the doctor says, I don't know, or you eat too much sugar or whatever, there's always more than one factor. Like stress is always a factor in disease. So is infection, so is trauma, so is any toxins, etc. And the doctor nowadays does not have the time to listen to your whole history. It takes me 2 hours to extract all the information that I need to help a person get well.
And Dr. Sawiak, just before you move on there, for the benefit of the listeners and absolute transparency and full disclosure, I am your patient, and I had the privilege of having a number of appointments. But for our listeners, to Dr. Sawiak's point, the first time that I met you, we had a session together. It was a full and thorough exam that was going on. And I know I have the privilege of being geographically close to you, but I also know that you work with people really all over the world and across continents through the magic of technology. But it was incredibly thorough. At Deep Wealth, we talk about due diligence for your business. This was due diligence for my health, of the questions you're asking and where we're going through. And so with that in mind, Dr. Sawiak, when someone gets a quote unquote clean bill of health from their doctor, an annual visit, what aren't they perhaps having looked at? Or where are there still some invisible dangers that they're not aware of that you're seeing too often?
Too often I see parasites.
Okay.
People say, well, I don't sleep very well, my gums bleed, and I'm brain fogged. Brain fog can be parasites. But also, one thing that I just went through, which was very interesting, I moved into a new townhouse and put my office my home office into the basement, thinking that the electrical panel was there so I could plug anything in. And every time I went down, I was shuffling papers, but I was not getting anything done. And finally, I called a client of mine who is an electrical engineer and who has testing equipment. He went in there and he said, no wonder you can't think. At 2,000, whatever the measurement is, you get cancer. You are at 200,000 EMFs.
Wow.
And he said, you have to move your office, which was something that was very difficult, but I did move it into a different part of the basement. I sat down yesterday at it and I had a clear brain. I was able to accomplish in an hour what I hadn't been able to accomplish in a week in the other location. So electromagnetic frequencies are another thing I look at. And people sleep with their phones right beside them and wonder why they're fog-brained.
And so when you're looking at your client population, Dr. Sawiak, what would be Pareto's law, the old 80-20 rule, that, okay, 80% of the problems that I'm seeing across my patient base is coming from these 20% of the root causes. And maybe it's 15% or maybe it's 25%, but close enough to 80-20. What are some of the top health issues that your clients are going through?
Well, toxicity. And toxicity will be your environment, your EMFs, your vaccines, because every vaccine is very toxic. And of course, emotional toxicity if you're in a toxic relationship. The other thing, of course, is lack of movement. COVID has really shown that people are working from home. They're not exercising. They're getting joint pains. They're getting slowing down in their reactions, etc. Parasites is something that people think, oh, we're in a clean environment. I don't have parasites. Yet they've flown in an airplane, or they have kissed their dog, or they've been to Mexico where there's parasites in the water, and they just don't know it. The average North American carries 300 parasites. The average person at the equator carries 3,000. Wow. And unless you put that under a microscope, you don't know. The other factors, of course, are electromagnetic frequency. Other aspects, of course, are relationships and things like COVID that have stressed people out, and stress is always a factor.
And so for our listeners, you're starting to understand why in the official introduction, you heard Dr. Sawiak introduced as the health detective, because these are things that are really extraneous. They're out there. And so for someone, whether they're in North America or Europe, we'll call it more the quote unquote, I don't know what the politically correct term is these days, the first world countries, and they're saying parasites, really, I'm not in the jungle, I'm not in the backcountry. How could I possibly have parasites? Everything is clean around me. So what would you say to that person?
Well, if you've flown in an airplane, you've breathed in the recirculated air. And some of my airline personnel were my most frequent clients where they got reinfected. And eventually I had to tell them to carry with them some kind of medication that would prevent them from getting reinfected. And one of them would be a black walnut tincture, or, for instance, chewing cloves, or using essential oils, things like that. And pets, they sniff everywhere. And then they come to bed with you. So you don't get rid of pets, but you get rid of their parasites. And those are the kinds of things that we're just not aware of.
Interesting. And let me ask you this, Dr. Sawiak, and I know you, rightly so, you could say with the question I'm going to ask, Jeffrey, every person's different. It's really on a case-by-case basis. That said, though, for our listeners, one of the things that we always encourage is after every episode, they can take at least one action today to put them in the right direction for the better. And so what could listeners start doing? What would be some low-hanging fruits that they could start doing now that would really help improve their health? Something that they can do on their own before speaking to someone like yourself that could really make a difference for them. What would you suggest?
Start with owning your own health. Stop taking any prescribed over-the-counter medication without checking the side effects. And the side effects you can Google. Also, your doctor, your pharmacist are not God. Question them. Say, what are the side effects of this? Why do I need to take it? Is this going to fix the cause? If it doesn't fix the cause, then keep looking for the cause until you find it. And eliminate the cause. Don't cover it up with medications. Refuse things like vaccinations, but increase your immunity so that you don't need to worry about things like that.
And so when it comes to increasing immunity, and I want to go back to the root cause in just a moment, but what can we do to increase our immunity? That's a terrific suggestion. Hey, increase your immunity. You won't get sick. You won't need outside medicine to do that. What does that look like? What are we doing?
You start off with adequate water, believe it or not, and pure water. So no tap water, because most water in North America is fluoridated, and it kills your thyroid, which is part of your immunity. Secondly, taking adequate supplements of vitamin C, because we say, oh, I drink orange juice. An orange taken off the tree in Florida, ripe, has 80 milligrams. When it comes to a northern state or to Canada, by the time it is ripened in the truck with ethylene gas and stays on the shelf from November till March, it has maybe half, we're lucky, of that vitamin C. So supplementation, unfortunately, is an absolute necessity in this day and age. And I recommend taking a lot of vitamin C and a lot of vitamin D3 plus zinc to increase immunity. Third is make sure you get fresh air, because fresh air is tantamount, especially with our EMFs. You need to go into a forest, and what they call forest bathing really counteracts the EMFs. Say, block your EMFs or reduce your screen time as much as possible. Do not carry your phone on your body. And if you have to live close to a cell tower, then find out how you can block all those EMFs. The other things, of course, are some mindfulness skills like self-hypnosis or EFT or meditation to reduce the stress of today's life, and seek social outlets that are going to feed you, that are going to give you the necessary socialization that we all need.
And Dr. Sawiak, that's a terrific list to start with. Let me circle back to vitamin D3. And my question for you is, should we be finding a vitamin D3 supplement with K2 for absorption? And how much vitamin D should we be taking? Because I know some people saying, well, I live in Florida or California or Texas. We get lots of sun, not an issue. I'm outside. But my understanding is that most people are vitamin D deficient, even though they might live in beautiful sunny areas.
One of the things is that unless you're almost naked, you're not absorbing as much vitamin D as you think. I take 10,000 IUs of vitamin D3, and I take K2 with it, because that way the calcium is absorbed into my bones and not into my blood vessels. And because I'm elderly, I take 1,000 of the K2.
And for the listener there who may share this with a traditional doctor, I know a lot of doctors, when they hear 10,000 IUs of vitamin D, you're going to take too much and that can hurt you. You're going to put toxicity into your body. It's too much. What would you say to that?
Well, one of the things they can do is just have their vitamin D tested. If it's below 200, I would supplement. 280 is what I aim for.
And so now we're talking different units, I suppose. The 200, the 280, is that, I guess that's the new units that I've been hearing more about, and the IUs are more the traditional older units?
Yeah.
Terrific. So you mentioned vitamin D, vitamin C, you mentioned zinc. I also hear out there in the research that most of us are deficient in magnesium. Would you agree with that, and what's going on with that?
I agree with that totally. Magnesium is absolutely necessary for our bones, for our stress levels, for sleep, and also for muscle cramps. And we don't get enough vitamin C. My friend Dr. Carolyn Dean wrote a book called The Magnesium Miracle that I highly recommend to anybody.
Okay. So you've covered off some of the low-hanging fruit, if you will, on the supplementation side. Let's go back to what you said earlier, because I suspect people don't realize that they are causing some of the health issues, starting with the products that they're using for their oral health. And if we just switch products, we want to keep up the terrific things that we're doing oral health wise to have a clean mouth, that's great. But switching products it's relatively easy. You're not asking to change lifestyle. It's simply a product. So what should we know with the products that most people are taking when it comes to oral health? What should we do? What shouldn't we do?
Well, start off with your toothpaste. Right on the toothpaste box, it says, if ingested by a baby, call poison control. And that is because of the fluoride and the SLS, most commercial toothpastes. SLS burns the gums and causes cancer. Fluoride kills your thyroid and causes some gum problems. Mouthwashes have isopropyl alcohol. Isopropyl alcohol is rubbing alcohol. You're not supposed to ingest that.
Wow.
If you put anything in your mouth, it is in your blood in 10 seconds. If you put it on your body, it's in your blood in 27 seconds. So that kind of absorption has to cause you to think about what you're putting in your mouth. The third thing, of course, is the materials that are used for the fillings and crowns and bridges and things like that. And when you have, let's say, a silver filling, the amalgam, and a crown that has some gold, nickel, and palladium in it, and then have an implant that is titanium. Electricity is created by dissimilar metals. And you end up with electricity going in between the various restorations, and you wonder why you're fog-brained. You're being zapped by that electrical current. The other thing, of course, is, for instance, palladium or mercury are both very toxic, but palladium is neurotoxic in the sense that people will get tinnitus in their ear, ringing in the ear, or they will get things like hearing a radio signal in their mouth because of the metals being used, and they are being treated psychiatrically. So there are various things that are just outside of the normal parameters. But oral hygiene products are some of the most toxic things that I've seen.
And how about things like mouthwash and breath fresheners? So you've mentioned toothpaste. What about those other areas for cleaning our mouth with liquids?
The safest ones are the ones based on essential oils.
Okay.
Salt water is excellent. If you don't have a lot of metals in your mouth, hydrogen peroxide is very good. Cut down with water, just 1.5%. But baking soda, all those are very effective. If you want some taste to it, just put a little bit of oil of peppermint in it. Many commercial products, including chlorhexidine, are actually very harmful to health.
So really what I'm hearing is, hey, look at the kind of products that you're using, and perhaps there's some easy low-hanging fruit there. Change up the products. And I know...
Read the labels and know what that means. Like just because there's a chemical name that daunts you, with Google, you can find out what that chemical does to you.
And so we've talked now products for oral health, vitamins. Any other low-hanging fruits that our listeners should be aware of to really help them take their game to the next level health-wise?
Yes. Get rid of the Bluetooth ear things. Okay. I see kids with two of them in their ears walking on the street with their head down, looking at their phone. First of all, the posture becomes a problem because they end up with spinal problems. Secondly, their breathing becomes different because of the head posture. Their dental bite can be changed just because of that posture. And of course, the electromagnetic frequencies are frying their brain from ear to ear. Wow. And we see children as young as 2 being given phones to play with or iPads. And I saw that at an airport. We sat there for 2 hours. The parents were on their iPhones. The 2-year-old was on the iPad the entire time. And I thought that is an abdication of responsibility by the parents.
Sure. And so, Dr. Sawiak, with all of this going on, for a lot of listeners, what they're hearing, I can only imagine, wow, this is overwhelming. I don't know where to start. It sounds very confusing to me. This goes against everything I've ever heard of ever since I've been able to understand and know something about health. So let's talk about, what does it look like when someone becomes a patient of yours? What's your system? And I know you mentioned the first consultation. It's a 2-hour consultation. You're going through everything. What happens coming out of there? And I know everyone's different and different health paths, but generally speaking, what would we expect?
I start with cleaning out the sewer, so to speak.
Okay.
Whether it's parasites, whether it's toxins, whether it's congested digestive systems, kidneys. So you can't take supplements to support your liver until your liver is clean. So you can't clean the liver if your bowels aren't clean and your kidneys aren't clean and you still have parasites. So the order of the detoxification and cleanses and the way that they're done are something that many people find unique with my approach. The other thing, of course, is we support the system with frequency devices. We use bright frequencies, we use pulsed electromagnetic frequencies, and we detox through the skin rather than through the liver as much as possible by using far infrared sauna. Ours happens to have ozone with it as well. Ozone is, I call it a miracle drug. It kills bacteria, viruses, fungi. It kills toxins. It oxygenates your blood, will take away pain in a joint. For instance, I had a car accident and a rotator cuff injury, and it's very painful. I inject myself with ozone and the pain goes away. It also is starting to repair my rotator cuff with the help, of course, of my chiropractor and my physiotherapist. But it's something that can help the average person to have less pain or to have healing. The other things I also look at are hidden infections. And these often are in the jaw bones because the extraction left some material behind, or the root canal got infected, or there was trauma, or there are various other reasons for it. And those are frequently sources of ill health. And an example, I had a fellow come in who was starting to lose the strength of his upper body to the point where he could not open a door, could not dress himself, and couldn't feed himself. He was being treated psychiatrically. And eventually they told him to go home and die.
Wow.
We have a machine or a scanner that scans for hidden infections in the jaw bones. And we found 4 of them in the wisdom tooth areas. And we treated them with what I call an eco protocol, which is something unique to me because I haven't heard of anybody else using it, but it's a combination of therapies. Within 3 months, he was back to work.
Wow. You hear so many people who get sick and stay sick. When you hear something like this, it almost sounds too good to be true. Is there a catch to this?
No, it isn't a catch, but it's an awareness. If you have an infection, whether it happened to be on the meridian of his upper body muscles. Another one that I had ended up with seizures, and it was because the cavitation went from the surgical site right into the brain. It created an abscess in the brain. And those are things that medicine and dentistry do not see, and they just treat it with drugs or treat the symptoms with drugs, but they don't get rid of the cause.
Dr. Sawiak, there is so much here that we can unpack. And you know what? Each one of these topics really could easily be an episode in and of itself. Let me ask you this. We're going to need to start wrapping up. But before we go into wrap-up mode, for that listener who's hearing all of this and is, wow, I've never thought of it like this, or this is the first time I'm hearing something like this, it's giving me pause to think. What, again, and I know we spoke about this a few moments back, but if they could do one thing and one thing only for their health, and I know that's a hard question to ask because there's so many things that we want to do, but what would be the one action that would have the biggest impact if you had to put one out there?
Question everything that is being prescribed.
Okay.
And avoid pharmaceuticals, keep your body clean, and study health. Own your own health. And things that, if somebody has questions, I'm glad to do a complimentary 15-minute discovery call with them. Because sometimes it's just lack of water gives symptoms, whether it's depression or fatigue or mental issues. Just something that simple.
And for listeners, what's interesting here with what Dr. Sawiak is saying, and really in many ways, Dr. Sawiak, what you're sharing in terms of strategies, health strategies, are similar to here at Deep Wealth and what we do with our 9-step roadmap. It's best practices. If you take ownership of your health, ask questions, don't take anything for granted, challenge authority, and make health a priority, everything else falls into place from there. You can go to someone like yourself who can begin the path of, okay, let's get you back to a full and restorative healing, or whatever that case may be. It's a terrific strategy that you're sharing with us. So from a health strategy, let's go into wrap-up mode. And here's the question for you. If you think of the movie Back to the Future, you have that magical DeLorean car that can take you to any point in time. And so, Dr. Sawiak, is tomorrow morning, we're going to have some fun with this. You look outside your window. Not only is the DeLorean car there door is open and it's waiting for you to hop on in. So you jump in and you can now go to any point in your life. Dr. Sawiak, when you're a young child, a teenager, whatever point in time that would be, what would you tell your younger self in terms of life wisdom or life lessons or, hey, do this, but don't do that? What would that sound like?
I would question the authorities that taught me much more. I would say why, and why again. Many of the professors that are supposed to be our gurus actually were not practicing dentists.
Okay.
And so their book learning was what got them the professorship. I'll use an example. My girlfriend's daughter graduated from high school at the age of 16, became a dentist at the age of 21, top of her class. And my friend said, she's so young, can you take her under your wing? I did. For a month. All I heard was, oh, that's so hard. How can you do that? That's so hard. She was book smart, but as a dentist, she couldn't do anything.
Wow.
She ended up in public health, quitting that. And then she applied and got into the Royal College of Dental Surgeons, which is our state board of dentistry. And she became a quality control officer. So she sits in judgment of dentists doing wet finger dentistry. And this is the kind of thing that happens. Politics is sometimes the worst thing that happens to the medical, the dental, or whatever profession we have. And so we need to, if my younger self was going into this, I would really try and get this kind of thing very clear in my mind so that I could avoid some of the pitfalls that I fell into.
Wow. You know, it's so powerful. What were some pitfalls for you can be really the benefactor for someone who's learning from you, that they don't have to do those pitfalls. That's because right. For better or for worse, you did that and you're paying it forward. And we're so grateful for that. And Dr. Sawiak, we'll have everything in the show notes for our listeners. It'll be a point and click. If a listener has a question for you that they'd like to reach out, or they want to take you up on that wonderful offer of a free 15-minute consultation just to see big picture-wise where things are, how can someone reach you online? Where's the best place?
First of all, going into my website, www.drsawiak.com, and there you have my phone number, my email, and my cell phone number. So you're very welcome to use any of them to reach me. And there's a lot of information on the website as well. The other thing that I'm developing right now is an app that is called The Health Detective, and it's available for Apple and Android. I'm still working on populating that, but there is a lot of information there as well.
Terrific. And again, for our listeners, if you're not sure how to spell Dr. Sawiak or what that is, or hey, I didn't get a chance to write that down, it's all in the show notes. It can't get any easier. Come to the show notes. You'll have all that information. You can reach out to Dr. Sawiak. Some of the resources that you've mentioned we'll also put into the show notes as well, Dr. Sawiak, to make it easy for the listeners. Well, Dr. Sawiak, as we wrap this up, it's official. We are done. I am so grateful that today you came on and really paid it forward with some information that most people probably haven't heard. And perhaps we can wrap things up the way that we started, by acknowledging that our health is our first wealth and everything starts from there and flows from there. And it's interesting. I was speaking with a very successful business person the other day, and it's an old saying that's been around, but he said, Jeffrey, it's so true. Because in the early days, sacrificing health for wealth is what a lot of people do. And then when we get to the wealth part, we want to sacrifice our wealth to get back to the health. And it's a vicious circle. Why can't we have it both? We can take things the right way, have our health, have our wealth, enjoy both at the same time by being really thoughtful about it as we head into that. So Dr. Sawiak, thank you so much for enlightening us and sharing that information. And as we say here at Deep Wealth, please continue to thrive and prosper while you stay healthy and safe.
The Deep Wealth experience was definitely a game changer for me.
This course is one of the best investments you will ever make, because you will get an ROI of 100 times that. Anybody who doesn't go through it will lose millions.
If you don't have time for this program, you'll never have time for a successful liquidity.
I mean, it was the best value of any business course I've ever taken. The money was very well spent.
Compared to when we first began, today I feel better prepared, but in some respects, maybe less prepared, not because of the course, but because the course brought to light so many things that I thought we were on top of that we need to fix.
I 100% believe there's never a great time for a business owner to allocate extra hours into his or her week or day. So it's an investment that will yield results today. I thought I will reap the benefit of this program in 3 to 5 years down the road. But as soon as I stepped forward into the program, my mind changed immediately.
There was so much value in the experience that the time I invested paid back so much for the energy that was expended.
The Deep Wealth experience compared to other programs is the top. What we learned is very practical. Sometimes you learn stuff that is great to learn, but you never use it. The stuff we learned from Deep Wealth experience, I believe is going to benefit us both.
I've done an executive MBA. I've worked for billion-dollar companies before. I've worked for smaller companies before I started my business. I've been running my business successfully now for getting close to a decade. We're on a growth trajectory. Reflecting back on the Deep Wealth, I knew less than 10% what I know now. Maybe close to 1% even.
Hands down, the best program in which I've ever participated. And we've done a lot of different things over the years. We've been in other mastermind groups, gone to many seminars, workshops, conferences, retreats, read books. This was so different. I haven't had an experience that's anything close to this in all the years that we've been at this. It's 5-star, A+.
I would highly recommend it to any super busy business owner out there. And Deep Wealth is an accurate name for it. This program leads to deeper wealth and happier wealth, not just deeper wealth. I don't think there's a dollar value that could be associated with such an experience and knowledge that could be applied today and forever.
Are you leaving millions on the table? Please visit www.deepwealth.com/success to learn more. If you're not on my email list, you'll want to be. Sign up at www.deepwealth.com/podcast. And if you enjoyed this episode, if it added value, if you walked away with some new insights and strategies, please leave a review on your favorite podcast channel. Reviews help us reach new listeners, grow the show, and continue to create content that you'll enjoy. And as we wrap up this episode, as always, please stay healthy and safe.